This podcast is for educational and entertainment purposes only and should not be considered medical advice.
Welcome to Table Rounds. We're here today. We are with Newly Made Academy, lighting the way. Table Rounds, Table Rounds, Table Rounds. Your voice, your guide. Together with knowledge, we stand side by.
Endometriosis is a condition where tissue, similar to the lining of the uterus, grows outside of the uterus like the fallopian tube or ovaries, or even the bladder. It is a chronic gynecologic disorder that can lead to pelvic pain and infertility. It can cause severe pain, especially during menstruation. Pain can occur during intercourse or with urination.
Doc, I get really bad stomach pain during my period. I can hardly move.
It's most likely just heavy cramps. Every woman has to go through that. You can take some ibuprofen and get some rest. I'll write you a prescription dose.
Here's the challenge. Endometriosis symptoms often look like other, more common conditions. That's why they're so often dismissed as just cramps or stress. But real diagnosis takes time, careful listening, exams, imaging, and sometimes a biopsy. Too many women spend years in pain before anyone takes them seriously. And for some, that delay leads to infertility.
Thank you for ordering the MRI and the biopsy. For years, I was told it was in my head, or that I have fibromyalgia.
Fibromyalgia is a diagnosis of exclusion. You have endometriosis, and we can treat this. Endometriosis isn't rare. It's underdiagnosed. Listening can change everything.
Because when women are heard, they're healed. To learn more about endometriosis and other conditions, subscribe to our channel or join our health community at HealthProX.
Welcome, everybody. Welcome to Table Rounds. I'm Dr. Princess Dennar, a board-certified internist and pediatrician, and I'm here with my co-host, Dr. Darlonda Harris.
Hi, I'm Dr. Harris. I'm also a board-certified internal medicine pediatric physician, and I'm also board-certified in obesity medicine.
And today's topic is endometriosis. And we have with us today a very special guest, Ms. Tanya Ross, who's going to talk about her experience with endometriosis and how she navigated the healthcare system, the barriers she experienced, and how she overcame some of the obstacles that was put in front of her. Welcome, Ms. Ross. We're so happy to have you.
Thank you. I'm excited to be here, and I am excited to share my experience.
Excellent.
Awesome.
Excellent. Well, let me level set, right, for the people who are watching this. So endometriosis, for those who are not familiar with that, is a condition that affects millions of women, right? So it's a condition where we have endometrial tissue, which is known as uterus tissue, that is growing outside of where it should grow. So it's growing outside of the uterus. It grows in the pelvic area, fallopian tubes, inside the diaphragm, around the pleural cavity. So it grows other places. And as a result of that, it causes inflammation. And when we have this inflammation, the inflammation can present differently. Most commonly, it presents with pain. So it can present with pain with intercourse, pain when you have your menses, pain when you urinate, pain when you defecate, right? So it presents with chronic pain. And for millions of women, doctors who are not familiar with this, particularly primary care physicians who might not be familiar with this, it goes undiagnosed, particularly for Black women who sits within the intersectionality of being women and Black. A lot of times their pain are ignored, misdiagnosed, or even mistreated. And there's a stigma regarding pain within the Black community, and particularly Black women who suffer with endometriosis. So, Ms. Ross, I'm so excited that you're here, and I'm so excited that you get to be a voice to talk to us about your experience. Can you just start off with, how did it start for you? Like, what happened in regards to pain? What were some of your symptoms?
Well, first, let me start by it actually started high school. For one, my cycle started later than others. I didn't have my cycle until I was a senior in high school. And with that, of course, I was in sports. I cheered and I also played softball. But I never had a normal cycle as my classmates or my teammates. So with that, my mom and I would tell my mom, like, Mom, my cycle didn't come on this month. So of course, back in the The only thing they knew, you didn't have a cycle. That means that you're having sex. I wasn't. I was too involved in sports. So it wasn't that. So what I would do was I would kind of guide myself with my sister's cycle. So I know if my sister came on this month around this time, I should come on around this month, this time. It never did. They were always irregular. However, when I did have them, they were excruciating pain. I can remember when my cycle did actually come on. It was actually the day before the first day of my senior in high school. My aunt was in town from Tampa. And I told her, I said, Auntie, my stomach hurts so bad I can't get out of bed. So she was like, oh, it's nothing. Here, take this.
Yeah.
It didn't work. I laid down for about 20 minutes and I said, Auntie, it's just not helping. My stomach hurts so bad. I was balled up in a fetal position because the pain was not only a menstrual pain in my stomach, my back was hurting, my head started hurting, I started getting nauseous. I actually got high. So after that, I didn't go to school. My mom kept a gauge on when my cycle would start. So we started that. They were irregular. So we finally my mom actually worked at a hospital. So
Okay.
she got in touch with some of her colleagues to ask around to doctors to see what is this? Why is her cycle so excruciating? And why aren't they regular? She's just started. So it should be on point. My mom found a doctor for me. Went to the doctor.
Was he primary care or was he OBGYN? If you remember.
He was actually OBGYN.
Got it. Okay.
So when we went, he asked my mom all the questions. Is she having sex? Like, is she really active? You know, he was asking my mom all these questions. And she was like, well, she cheers. She plays softball. You know, she's always at home. He was like, well, you know, if she's out with her friends and she may do something outside that you don't see.
Right.
No, I don't do anything like that because, for one, I'm afraid of my mom. So then he started, going into things, and then he took swabs and all types of stuff. And he actually diagnosed me with having some type of sexual transmitted disease. I can't remember what it was. And my mom was like, but if she's not having sex, how are you going to diagnose her with this?
Right.
Everything just went out the window. I told my mom I don't want to go back. For one, I wasn't comfortable because his bedside manner was horrible.
Right.
So she was like, okay, well, we're just gonna watch. Years down the line, of course, cycle's not regular. Now I'm of age where I can go to the doctor by myself. I'm asking questions. I'm telling him, look, my cycles aren't normal. By this time, I've changed my OBGYN. And he's like, well, we're gonna have to look into this because this isn't normal. I will go months without having a cycle. But that one time I had it, it was horrible. So what he did was, he says, okay, we're going to take some blood work. We're going to just do some exams. And I was like, okay. I never knew what laparoscopy is. That a thing?
Laparoscopy.
So he says, well, this is what we're going to do. He says, I don't want to treat you like you're some type of lab. He said, but I got to find out what's going on. So he told my mom, this is what we're going to do. She says, okay. She was like, Tanya, are you okay with that? And I was like, yeah, Mom. If I can just get my cycles regular, I know what's going on. Went in and I had those. I swear it was like every other month I was going to have something done.
Wow.
So I had a couple of those. Once I finally had my last one, he said, this is what I found, because he kept doing research. He said, this is what I found. First, let me say that you do have an enlarged uterus.
Yep.
So my uterus was tilted. We had to
Retroverted.
go in and lift it up, whatever. He says, and you have endometriosis. And I looked at him and I said, well, what is that?
How old were you? How old were you when you got that diagnosis?
I had to have been about 22-ish.
Yeah, interesting. Okay.
22. So when he told me about the endometriosis and then with the uterus that was enlarged, I said, well, what does that have to do with me bearing kids? Because I do want to have children.
Right.
He says, well, it's going to be a little difficult until we go in, remove the endometriosis. He says, and lift your uterus. Well, I was like, well, I don't want to not be able to have children. So if that's going to hinder me from having children, I don't want you to do anything. So he says, if you want to have children, we have to lift your uterus. So I said, okay. So I said, well, do I have to do that right now? So he was like, no. He said, you have time. He said, but your cycles are going to be irregular. And when you have them, they're going to hurt. So then he says, we're going to put you on, what is it, Depo-Barrel?
Depo.
Put put me on that. My hair started falling. I said, no, I can't do. I said, Mom, I don't like this. So she
Right.
says, well, what do you want to do? So I said, well, Mom, I don't want to do this. I said, because this is too much. It's too much. I'm still active because now I'm helping out at a high school with the cheerleading squad. And I was like,
nice.
Mom, I'm always sick. So she was like, well, what do you want to do? And I was like, I just want to stop. I don't want to do anything right now. Put me on the birth control pill. I just want to stop. So once that happened, and then the pain just got so bad. So one day I was at work, and I can remember it like it was yesterday. My sister and I was talking about it recently. I was at work. I started my cycle. It was so bad. I crawled up under my desk in a fetal position. They had to call EMS to come and get me because I couldn't move. It felt like I was paralyzed from my waist down because the pain was it hurt so bad. Once I did that, then that's when I decided to go ahead and have all of the things that I needed to have done because I just couldn't take it anymore. He told me, he says, now, when you have this surgery, he says, I'm going to let you know, this is when he suspended my uterus. He said, I'm going to let you know that you're going to be very fertile. I say, fertile meaning what? He says, fertile meaning if you have unprotected sex, you'll be easily impregnated and you could get pregnant. So I was like, okay, all right, whatever. I said, but then what happens after that? He says, after that, if you don't get pregnant, then we're going to talk about hysterectomy. So that blew my mind.
Oh, wow.
I was like, wait. I said, I don't want to talk about hysterectomy because that means I won't be able to have children. And then you're telling me that if you suspend my uterus, then I'm gonna get pregnant like immediately.
Right.
He says, yes. He says, he wouldn't do a hysterectomy anyway because I was too young.
Right.
With
You were 23
children.
You were 23
Yeah.
at this time.
Yeah.
So he wouldn't do the hysterectomy. He said, so what we're going to try to do is we're going to try to get you a baby. I said, no, but I'm too young. So I waited a couple of years. And I was like, this ain't, something's got to give. So I think I was like 25, 26 years old. I had the surgery to have my uterus suspended.
Okay.
Yeah, absolutely. 6 months later, I was pregnant.
Oh, wow.
Yeah.
Wow.
My baby she's my miracle. That's why I tell her all the
is.
time. I was like, girl, you're a miracle. You weren't supposed to be here.
Yes,
That's a
she
blessing.
is.
But endometriosis has been, and I spoke with some of my friends at the time, it has been misdiagnosed in a lot of African American women. Because they told me their stories as well, and they were similar to mine.
Absolutely.
And it's a disservice to have some medical professionals that's not doing their due diligence to find out exactly what it is in African American women, but they'll go across seas and across the world to help their own. And I just felt like, am I less of a woman to not know what's going on with my body? I know what was going on because I'm always in tune with what's going on with my body.
Yeah.
But am I less of a woman to not ask more questions? Was it something else that I could have done? Is it hereditary? Was I doing the wrong things? And a lot of those questions were never answered.
And that's why it's so important to have these types of venues and have these types of conversations because you're not alone. There's so many people out there who are having literally right now, still in 2025, these same types of questions like what's wrong with me? What could I have done different? Did I do something? Right? And that's why I wanted to have this conversation with you. So we really appreciate you being open. Your story is something that I think transcends across this country. And a lot of people think that endometriosis is something that affects older women and don't realize it really starts pre-menarche. So right before going into your period, during the reproductive years, and then postmenopausal is when endometriosis. So there's a gamut of age of when endometriosis can occur. Now it peaks at 25 to 35, but there's a gamut of age where endometriosis can occur. And unfortunately, because a lot of physicians might not be aware of that, right? So the internist or the OBGYN who don't really treat young children, right? As a result of that, they're not even looking at that as a differential diagnosis to consider. And then the other thing that you mentioned was it was kind of brushed aside as if, oh no, this is your regular menstrual cycle. And so that's the myth that we want to demystify right now is that yes, it could commonly occur while you're having your menstrual cycle, but that excruciating pain that is out of proportion to what your regular menstrual cycle is, you're not bleeding clots, you're not doing it, but you're in so much excruciating pain, that should be a red flag to say, hey, there might be something else going on. And it was interesting too that he jumped straight to laparoscopy to make this diagnosis and doing a biopsy, because usually we will try the ultrasound. So the thing about it, very rarely can someone diagnose endometriosis by doing a physical exam, right? So very rarely they can do that. So when we do the pelvic exam, we might feel like enlarged uterus, we might feel nodules, but a majority of the time, we don't feel that the majority of the time. And I also believe that the physical exam is only as good as the physician who knows how to do it
Who
properly,
knows how to do it.
personally. Right. So and so it might get misdiagnosed. So, there's no markers. When I've researched it, they've talked about CA-125, which is also a marker you see in ovarian cancer, but we see it in higher proportion of people with endometriosis is what I kind of read about. But that's not a marker to say that you definitely have endometriosis when we do that blood test. And so it results in at least imaging. So ultrasounds or MRIs, and, always starting with the least invasive, trying the ultrasound first. And if we don't see anything, then move on to the MRI. And then finally, if we want a definitive diagnosis, and now what I would say, you getting that biopsy gave you a definitive diagnosis of what they saw under the microscope, right? So being able to get that biopsy and actually to see the abnormalities with the tissue, I think is also important too, as well. So Dr. Harris, from your perspective, from the patients that have coming into your clinic, have you had young teenagers, because you're med peds, right? So have you had teenagers also coming in with severe abdominal pain, and have you referred them out to the specialist? Would you recommend that, or how have you treated them?
So I definitely see young adults, young women, especially all the time talking about how excruciating what they call their period pain may be. And so some people, you want to say, could this just be their period? But that's not fair. You shouldn't just assume, oh, this is your period, this is how it will be, I'm sorry you have to deal with this. That's not okay. I feel like they should definitely have a thorough workup. So many times when they do come to me, and after we've tried just, measures, medication, I do refer them out to get more further evaluation. So definitely, I feel like it's something that should not go untreated and unrecognized, and it should be worked up. And I just want to say thank you for sharing your story, because I've heard so many stories similar. And for me, it's so difficult at that young age deciding, do I resolve the pain versus do I consider I may not ever have children? I mean, that's a big decision at 22, 23 to decide when you're not even in a relationship, or that's no one on your mind. You're in school, you're trying to do your thing. So I definitely, I can't really, I mean, I definitely appreciate you coming on just to share that story and to just really show how it's so many things going through your mind at the time, so many decisions that you're not prepared for. Some people have never even heard of endometriosis. That's a big deal in itself. So it's very important to take the time as providers to educate ourselves, to educate the patients, and to also just provide a community like you're doing right now so that other women can have a safe space to talk about these issues. And Ms. Tanya, what do you suggest, what do you recommend to other women that may be going through this right now, similar symptoms to what you were experiencing?
My recommendation to all women that's going through this with themselves, or if they have young teenagers, to continue to ask questions, get second opinions. Sometimes the doctors that they may have may just be telling them certain things because, of course, we're not, educated medically to know what they're telling us is true. But if you know your body and you know that you told me that I take this pill, it's going to help, but it's not helping, ask other questions and get second opinions. My thing was with me, because the first doctor bedside manner was horrible, I told my mom, I said, well, Mom, I don't want to go back. For one, if you have a relationship with your doctor, and I tell my daughter all the time, you have to be able to talk to your doctor to tell her or him what's wrong with you and be comfortable with that. Because if you're not, then all they're going to do is try to pull at straws to tell you what's wrong with you.
Right.
Ask questions, because if you don't ask questions, you'll never know. And second opinions, of course.
Absolutely. Absolutely. Asking questions, and you don't know what you don't know. So sometimes it's not as simple as asking questions because people don't know what questions to ask. And I think that's a key factor here. Like, where do we get this trusted information? And right now, as we're living in the world of this endemic of information on the computer, and not everything being evidence-based and not everything being accurate, sometimes people get the wrong information and don't always ask those appropriate questions. But one of the things that I heard you say was get a second opinion. And that's something that people don't realize is important and key when you feel uncomfortable with a physician or you just don't agree with their diagnosis or how they're treating you, get a second opinion. And it's okay to get that second opinion. And one of the things that I think is also important to recognize are the barriers that do exist, because sometimes it's not easy to get a second opinion. And there are bottlenecks that exist. And particularly for those individuals who have Medicaid or those individuals who are low income, who might not have a commercial insurance with PPO where they can choose a specialist of their choice, right? So it requires their primary care physician to refer them to a specialist. So that within itself, like getting the authorization or prior authorization to get the laparoscopy, getting the prior authorization to get the MRI to even do the procedure, or even getting the physician, the primary care physician, if you're Medicaid, to agree to send you to a second OBGYN and not say, oh, well, this GYN already made this diagnosis, so I don't see a need for it, right? Which does happen. It was interesting in your experience where, you kind of took a step back in the sense after that first doctor, right? And in the sense, well, I don't want to go back. This is invasive. This is too much for me. I don't feel comfortable. I don't want to go back. And that's what happens to millions of women, particularly millions of Black women who are trying to seek help. They get an experience that really deters them from coming back to that physician or coming back to the healthcare field in the first place. And one of my recommendations that I would say is that when you try to research it, find a reliable resource. That's the first thing, a reliable resource. ACOG, American College of Gynecology, Obstetrics and Gynecology gives information, but find a reliable resource. In this case, if we're talking about endometriosis, and write your questions down. The doctors are supposed to be able to answer these questions. And any physician who feels that you're asking too many questions, you're asking too many complicated questions, then that might not be the best physician for you, right? That maybe you might need to want to think somebody else, right? And for patients who have commercial insurance, and particularly if you have a PPO, allows you to go to any doctor. So you can say, hey, I don't like this experience. I want to go to another doctor, and that's fine. But patients who are Medicaid patients who don't have that ability to do that, be armed with the knowledge that you can call your managed care organization, whatever Medicaid plan that you have, and say, hey, I would like to switch to another primary care physician. And that primary care physician can now refer out if it's something that it requires referral, like OBGYN can refer out. But asking the right questions and asking questions, I agree with you, is key. It's totally key to this. And the thing about it too is the fertility. So that was interesting because if this gets diagnosed, what the studies have shown, the longer you wait for treatment, the more likely you will not be able to have a child, right? The longer you wait that you sit with this diagnosis. So imagine millions of Black women out there that has this endometriosis, not getting diagnosed, is getting diagnosed late, right? When we talk about this infertility issues that's beginning to increase in our community too as well, that's something that I think is important that we need to think about too as well.
Yeah. And I also feel like when you know your body and you know when something's not right, it's kind of like, okay, if I take a Advil, okay, it'll relieve the pain for a little
Yeah.
while.
Yeah.
But if I have to go and get something that is prescribed stronger than something that I can get over the counter, that means for me, it's something more serious.
Right.
Because if I can't just take a pill from Walgreens, but my doctor have to prescribe me something, then I feel like my doctor should be able to tell me, okay, because I got to prescribe you this, there's something else going on.
Absolutely.
And when you mention, you have to know the questions to ask. That's why I say you have to be comfortable with your physician. Because if you're comfortable with your physician, you should be able to go in and say, okay, I had a cycle, I had excruciating pain for a day, but my cycle only stayed on for one day.
Right.
But normally I'm on for 4 or 5 days. So
Right.
then right there should be a red flag to say something ain't right, because Normally you have a 3 to 5 day cycle, but you only had one, and then you missed 3 months, and then you got another cycle. And for me, I felt like it could have. I always ask doctors, is that something that is hereditary?
Mm.
And if it is, when I am able to have children, is that something that I can pass on to my child? Which is something that is happening right now with my daughter. She's having some of her female issues as well, and I've always wanted to know, is that something because of me? Is it hereditary? So when I did decide that I did want to have a child, that was one of the questions that I asked my doctor. If I'm having these issues and if I have a daughter, will she have the same issues? He said, no, it's not hereditary. I said, okay, well, how did I get it? Where does it come from?
Right.
Why wasn't my cycle normal? My mom had a normal cycle. My sister had a normal cycle. Why was I the chosen one to have irregular cycles? What causes it?
Right.
Was my questions.
Right.
And of course, I didn't get answers. I got piece answers, but still none that I could actually relate to.
Right. And well, I will say this. So I agree with you on, being comfortable with your physicians. That's key, right? And I do have a question regarding that for you, Ms. Ross. But before I say that, I also want to say that a lot of times right now, there are diseases that exist that we don't know a lot. And it's okay to say that we just don't know yet. We don't know why it happens, right? And they are doing genetic studies to look to see if there's a genetic component to this, but I do tell patients that I do believe there's a familial component to it, which is very different than a genetic component to it. Because what we have seen is that certain foods do aggravate this inflammation. Right. And I'm a big person that believe that food, not only is food medicine, the right food is medicine, but I also believe that the wrong food is harmful. And a lot of foods now in our industrial world is inflammatory. A lot of the meats that we eat. So when you look at some of the causes, the things that can aggravate it and make it worse, interestingly, are foods like beef and chicken and it's not inherent to beef and it's not inherent to chicken and it's not inherent to all of these meats, but what it is the products that they're putting in this food that causes an inflammatory process as well. Because that inflammation is a key component that I think is important that we look at as well. So we tend to pass on how we eat to our children. So our children cook the same dish that our moms cooked, and and our moms cook the same dish that their moms cooked, right? And so that's where I say it's a familial pattern, right? And it's worth looking at countries, or it's worth looking at populations that don't have the influence of hormones and growth hormones and estrogen and all of this stuff being pumped into our food meats so they can sell it for larger prices. It's important looking at those and looking at the diseases that exist there now when they don't have this happening. So I think that plays a role, and it's interesting. One of the things I think is important that we don't do as Black women is blame ourselves genetically for a condition that is iatrogenic or a condition that is outside of us, right? And yes, there are components, and for every disease, we play a role to it, but there are certain things that are outside of us that plays a role. So I think that's important that I say that. And what my question that I initially was going to ask you, Ms. Ross, would be if you had something to say to physicians, what would that be to tell them how to treat you when you're coming in with these types of complaints? What would that be that you think hopefully can shift the paradigm and they can see you for who you are and give you the best equitable care as possible? What would you say to them?
I will, as a Black woman, of course, my previous physicians were always of different race. It was always seen as, oh, it's not that bad. Your pain level isn't that high. They always brush off what I knew was hurting me. My suggestion to physicians would to be to listen to what the patients are actually saying. Yes, you do have some patients that may over exaggerate pain. But if you have a patient, and I'm going to use myself, such as myself at a young age, that was always complaining of menstrual pain, and that was the only thing that I complained about, that's something that I feel like my physician should have actually focused more on, other than what he thought it was. I have had great physicians, Dr. Dennar, that listen and educate. I wish more physicians would educate their patients on the symptoms that they have. And okay, I have bad menstrual cramps. Okay, well, if you have bad menstrual cramps, then try to drink warm milk to help this, or try to do, instead of laying down, drinking cold drinks, drink something warm, to help with your menstrual pains. I wish physicians would be more informative with their patients, because you have some physicians that get you in and out. You come in there and say, "Oh, my stomach hurt." Okay, you have bad menstrual pain. Here, I'm gonna prescribe you this. Instead of educating that patient on what could possibly be, what they can do to not have such excruciating cycles. Some physicians that I have had in the past mostly were of how many patients I can get in to know how much money I can make. A lot of times when I would go to some of my doctors in Florida, it was how many patients I can get out today, because I would hear them say, "Okay, we only got 10 patients today. I need 10 more." And I'm like, these are people.
Right.
This isn't like we're trying to sell something. But just for physicians to listen to their patients. I think some patients actually come to physicians for things other than just their health, their physical health.
I agree with that.
Some patients come in to have someone to talk because they have other things that's going on in their lives, but they're comfortable with their physician to talk about certain things. And again, I gotta commend you, my doctor, that you take the time to listen to other things about your patients other than their health. How are you feeling today? What's going on? You need to do this, because a lot of times, and I've noticed that for me, I've noticed that now that I have gotten out more, I feel better. I don't feel sluggish. I don't feel like I just want to lay in bed every day, all day. Now that I've gotten out and gotten a second job, my body feels different because I'm moving more.
Right.
So I think physicians should also give other recommendations other than medication to always help with pain or help with your health, because just going out for a breath of fresh air
Yep.
can do miracles
Yep.
for just your overall being. So
Yep.
I think that's what I think physicians should do for their patients.
Thank you for saying that. I appreciate that. Thank
You're welcome.
you.
I really appreciate you sharing what providers should look for when they have patients that have pain, because that's so important, because many times the patients are just very discouraged.
Yeah.
There have been to multiple providers. There have been, even from my own personal experience, I know just going to multiple providers, taking multiple medications, getting frustrated, and just having that sensation of, will I have to live with this for the rest of my life?
Right.
It can be very, very frustrating. So thank
Right.
you for sharing that to myself as well as other providers.
I
And
agree.
I also want to say this too. And I do know that sometimes the situations that we're in, such as myself with the endometriosis, with it being as bad as it was, because I did have once I finally got the right physician, he actually literally walked me through everything. And I would ask him, if I was your daughter, what would you do? What suggestion, what recommendation would you give your daughter? And the decision to have a full hysterectomy because of my endometriosis, it took me months before I finally decided, because he told me, he said, your endometriosis is bad. He says, and if you have a partial hysterectomy, which was just to take the uterus, he said, your endometriosis is so bad, it could be embedded in your ovaries, something that we can't see. I can't see that unless I go in and see it. So I told him, I said, well, when you take my ovaries, then what? What is that? He says, well, then you have to take the hormone replacement therapy. And I'm like, well, what is that? I got to get shots. What is that? And he says, well, it's a pill that you'll have to take to replace your hormones. The one thing that I do regret, and I don't have a lot of regrets. The one thing that I do regret is having a full hysterectomy because I felt as if I kept my ovaries, I wouldn't have had so much depression
Mm.
because I did want to have more children. And once that's gone, those chances are no longer. I wish I would have just waited a couple of years before I had my hysterectomy. Sometimes, as women, if you say, well, this is what needs to be done, because we're emotional creatures, we're emotional beings, we just go with the first decision that pops in our head. And that is one decision that I regret. And my suggestion to other women is to just wait to see how it's going to work out before making a decision as drastic as having a hysterectomy.
Absolutely.
'Cause it could be some could be avoided.
Absolutely. And I appreciate you saying that. So thank you for saying that. And, when I first came to Louisiana in New Orleans, it was one of the first times I've heard of what we used to call the Mississippi appendectomies. And I'm not sure if anybody's familiar with that, but what that is was that the disproportionate amount of Black women who were recommended to have a hysterectomy or who were having hysterectomies from the medical community and were not aware of it, right? And they called it a Mississippi appendectomy. So when I first came, when I would do a history on a patient, a female patient, it was so profound to see how many of them did not have their uterus. And I was shocked at various ages. What do you mean you had a hysterectomy? What for? Right? And it was so profound. And I appreciate you ending with that and saying that because this is what I would say. There are second opinions for a reason. And I think it's important to get a second opinion. And the studies have shown that we are more likely to be introduced the idea of a hysterectomy as a treatment option as opposed to other things than any other ethnic group. And we have to ask ourselves why, right? At some point,
Yes.
we have to ask ourselves why, right? And so that's one piece of it. But the other thing is just the number of physicians or Black and Indigenous people of color physicians that exist in the United States now is less than 5%. Right. So we obviously cannot be present for every single patient of Black and Indigenous origin.
Mhm.
Right. And that's why it's important that we give these messages out. And, my recommendation when someone says as the first option, oh, a hysterectomy, then potentially run from that person.
Yes.
Run. Because endometriosis is not a malignant disease in the sense that it's cancer. And I think it's important to acknowledge that it is a painful disease, but it's not a malignant disease. And when options do exist, acupuncture, anti-inflammatory medicine, acupuncture, pelvic wall physical therapy, like all these other potential options first. And if you have not introduced these options to your patient who is of childbearing age and who clearly want to have other children, then I think you're doing a disservice to this to the art of medicine, and you're doing a disservice to that patient and to our community. And it's important that people know that. And so I'm glad that you touched on that. Hindsight is always 2020. What was meant to happen, I believe, happened, right? Because I
Mhm.
believe it gives us a voice and it gives us an opportunity to learn for something to teach other people. And so what was meant to happen always happens is my truest belief. So it was meant to happen, right? And you went down that path for a reason. Right. Whatever that reason is definitely was a reason. And I think you've came out on the other end as a even a better person. The message, regardless, for especially for young Black women who's not familiar with the medical world, who's uncomfortable with the medical world, who don't have advocates in the medical world, seek information from people that you trust, get second opinions as much as possible. And don't allow people to shut your voice up, right? Don't allow them to silence you at all, right? And the more knowledge is power. So the more knowledge we have, the more powerful we are in our discussions and arguments and dispositions. I truly believe that too as well.
I agree. I agree. And there's so many fertility saving treatments right now.
Absolutely.
Fertility, many women are freezing their eggs. that if you're faced with that decision of should I get this procedure that may change my life forever, definitely don't be afraid to ask what options are available. You never know. Just don't assume I might not be able to afford it, or maybe I don't know who may do it, but ask, because there's so many options available that you at least want to make an informed decision.
Yes.
Excellent. Thank you so much for joining us, Ms. Ross, at Table
Thank you for
Round.
having me.
We are so excited to get this podcast out. And for more information about endometriosis, please join Healthful X to learn more about endometriosis. Please follow us on our Facebook and continue, if you like hearing more information like this, continue to watch us on these podcast tape arounds. Thank you.
Thank you.